Unmasked presents the hospital in Brooklyn. In the summer of 1963, a doctor walked into a room at Jewish Chronic Disease Hospital in Brooklyn, filled a syringe with live cancer cells and injected them into an elderly patient's thigh. The patient asked what was in the syringe. He was told it was some cells. That was true. It was also a lie. This is the story of what happens when the people running an institution decide that consent is optional, as long as they believe they know better than you do. Chester Southam was not a fringe figure. He was a respected cancer researcher at the Sloan-Kettering Institute, a name that still carries weight in oncology today. For nearly a decade, Southam had been running a series of experiments injecting live cancer cells into human subjects. First into cancer patients, then into inmates at the Ohio State Penitentiary to study how the immune system responded to foreign cancer cells. His question was legitimate. Did cancer patients have weaker immune defenses because of their cancer or because they were simply unwell? But to isolate the answer, Southam needed a new kind of test subject, people who were chronically ill but did not have cancer. He needed a control group that was debilitated but clean. Sloan-Kettering wouldn't give him one, so he went looking elsewhere. He found Dr. Emanuel Mandel, the director of medicine at Jewish Chronic Disease Hospital. Mandel gave him access to 22 elderly, chronically ill patients, people with heart disease, neurological disorders, conditions that had already taken their independence. On July 16, 1963, under medical supervision, these patients were injected with live cancer cells beneath the skin of their thighs. They were not told the cells were cancerous. The doctor's own justification, later entered into the record, was this: telling them would cause unnecessary anxiety. In other words, the truth was withheld, not to protect the research, but to protect the patients from a reaction the doctors didn't want to manage. Several of the injection sites developed tumors. Not every doctor at the hospital was willing to go along with it. 3 physicians, Avir Kagan, David Leiter, and Perry Fursko, refused to administer the injections. Once they understood what was actually happening, they didn't file a quiet complaint and move on. They resigned. And they took it further, going to a hospital board member, a lawyer named William Hyman, who didn't mince words. He compared what was happening to Nazi medical experimentation. Given that many of the patients at this hospital were Holocaust survivors, that comparison wasn't rhetorical excess, it was the plain historical echo in the room. The case became public. It went to the New York State Board of Regents. And here's where the story either ends the way you'd expect or doesn't. Southam and Mandel were found guilty of fraud, deceit, and unprofessional conduct. Their punishment, 1 year of probation, not a revoked license, not a permanent bar from research, probation, a formality that let both men continue practicing, and 2 years later, Chester Southam was elected president of the American Association for Cancer Research. The same professional community that had just watched him found guilty of secretly injecting cancer cells handed him its highest honor. This case didn't stay contained to one hospital in Brooklyn. It became one of the direct catalysts for the informed consent standards that now govern human research. The same standards behind the institutional review boards that review clinical trials today, standards eventually codified in the Belmont Report. In other words, the system had to be rebuilt because this system failed, and the man at the center of that failure was rewarded by his peers, not exiled by them. That's the part worth sitting with. Not just what Southam did, but what it took for the institution to actually hold him accountable, and how little accountability ultimately looked like once it arrived. The pattern isn't new and it isn't over. An institution polices itself only as far as its own reputation requires. The doctors who blew the whistle lost standing in their own hospital. The doctor who ran the experiment gained a presidency. What they won't say, what you need to know. My name is the Unheard. This is Unmasked.